Hi everyone, this is Mr. Neil Reiter, consultant audiologist and director of ClearWax. Thank you for joining me in another demonstration video of our recently developed WAXscope. Just to give an update in terms of anticipated launch date, we were hoping to launch this early autumn, but there's just been a delay with the tooling for the specular that we are also designing, for, which is going to be a custom speculum for use with the WAXscope. We're anticipating end of November now. It's just these things do take time. It's kind of unfortunate beyond our control. If you are interested, do bear with us. We don't want to rush a quality product. We've come so far, and we don't want to rush things. If it's had to be delayed by a couple of months, I'd rather that than having things rushed and not good and proper. So I have a patient who attended with really blocked earwax bilaterally. This is their left ear. Now, if you continue to watch, you will see the importance of being able to use mechanical instruments. So St. Bart's ear hooks, Jobson Hornes, forceps, because without the use of those other mechanical instrumentations in this procedure, it would be very difficult to remove this wax, particularly in the right ear. So this is their left ear, and when you see the right ear procedure, we more or less exclusively remove that using a Jobson Horne. And so it's severely impacted. They've got quite a bendy ear canal. I'm using our 4.25mm speculum to dilate and straighten the ear canal, and you can see I'm just working around the edge of the canal wall, just trying to detach and separate this wax, which has got some skin enveloped around it, off the canal wall to mobilize it. I have used some olive oil spray as well, just to help lubricate the wax and the inside of the suction probes to prevent it from getting blocked. And I can see I'm making these rocking motions there, left to right, trying to detach it. In the right ear, the consistency of the wax is a bit more clay type as well, which makes it even more difficult to suction. And you can see I'm just rocking this left to right, just trying to detach it from the base. You can see at the bottom of the ear canal, the wax is enveloped with this skin, and it's been there for a while. Patient was really struggling to hear today upon attending. And with this type of wax, it's got this, as I say, clay texture, and it can really get impacted and occlude the ear canal, making it really hard to release and extract from the ear. So in terms of the speculum, we've got three other sizes. We've got one smaller than this. This is a 3.5mm specular. You can't really go any smaller than that in terms of earwax removal, because you struggle to put the instrument into the ear and be able to see clearly inside the ear. So 3.5 is just about perfect for those narrow pediatric ears. This is the 4.25mm, which is probably going to be the standard size specular. Then we've got a 5mm for larger ears, and then a 5.75, which would be more for your mastoid cavities. And slowly but surely we are bringing this forward. I'm going to use an ear hook in a moment, I think, just to dissect through this wax, just to break it up into little pieces. So although the wax didn't come out in a single piece when I used the ear hook, it did dissect through it, which then breaks it up into little pieces, enabling me to remove. So whenever you are using mechanical instruments, it's not always just to remove the wax. It can help facilitate suction as well. I think I've just put a bit more oil in. The patient was developing the gag reflex in this ear. So when you've got a branch of the vagus nerve called the Arnold's nerve, which is positioned underneath the floor of the ear canal, and when you apply a bit of pressure there, so as audiologists, we know when we take ear impressions, it can elicit a gag reflex. So the patient was coughing quite a lot actually as I was wriggling this out. So this lateral piece of the wax, it's just protruding out of the ear. But I think it's going to need a bit of a helping hand still with the ear hook, if memory serves me correct. So why the WAXscope? Our flagship product is the iClearScope endoscope. It's what we launched back in 2015, I believe. And in terms of optics, there's nothing really that can compete with an endoscope. If you've been watching my videos over the years, the view it provides is unparalleled compared to anything else that is any other visualization technique. However, using an endoscope it can be difficult to acquire the particular skill set for endoscopic earwax removal. Requires a lot of bilateral integration between both hands. Because there's no speculum used with an endoscope, you're having to use the endoscope tip itself to straighten and dilate the ear canal, and simultaneously visualize the earwax, and then with the opposite, your dominant hand, insert the instrument. And once you've acquired that skill, there's nothing that can really compete when using an endoscope, but it is quite difficult for some people to acquire that skill. So very early on, I realized the need to develop something with a speculum attachment, and several years later, so it has been a work in progress. There was loads of obstacles and bottlenecks to overcome just to get the perfect product. What we initially found is when you were inserting the instrument through the speculum, that because it's in direct line of sight with the camera lens, it really obscures the view, becomes blurry. So we've had to design something that's a bit different. So we've got the Tomarkin style slit at the top, the roof of the ear canal. I'll come back to the moment. So you can see we used the ear hook to help. You've got a lovely, pristine, clear view of that eardrum. You can see all the blood vessels. The view it provides, the WAXscope is similar to an ENT microscope. You can see, and this is all a handheld device. Got a stunning view there. We're going to move on to the patient's right ear. So again, quite a narrow entrance. We're going to adjust the focus. You can see how clear it becomes when we adjust the focus. Another bottleneck with the WAXscope was infection control. We didn't want a mounting system where you kind of attach a speculum, because although the speculum can be disposable, the suction probe, or whichever instrument you're using, is having to go through the mounting system. And how do you sterilize the mounting system? So it leads to cross-contamination between patients. So another key unique aspect of the WAXscope is the speculum in it. The way it attaches to the WAXscope, it's got a hollow core, an intermediary section, which is where the instrument is used to go through the speculum into the ear. And then we've had to work in terms of optics, getting the right magnification, focus. So it's taken us a while, but we're really pleased with the end product, and we're just waiting to launch it now very patiently. So we've got a great team working with us in terms of the speculum, the tooling, the injection molding, and it's just, as I said, several more weeks away. So you can see here, I'm just using the Jobson Horne, dilating the ear. So it was a bit more narrower, but I decided just to remove this without the suction, just using the correct. So you can see the consistency is very mud-like, very mushy. So I'm just angling towards the roof of the ear canal. You can see there's an opening there. So we're just going to glide the Jobson Horne in, over the top, in and behind, and then slowly extract. And when you extract an instrument like this out of the ear, whether it be the Jobson Horne or ear hook, you're just going to be careful that you don't over compensate. So what I mean by that is you don't want to embed the hook or Jobson Horne too deep into the wax, whereby when you're then extracting it, it's going to come in contact with the ear canal wall, at the floor of the ear canal, which can then graze and potentially cut the ear canal. So you're just going to be careful upon extraction. So making good progress there. So this wax, it was a large piece actually. If you watch to the end, you'll see a still image. Again, we just brought this forward, just going to remove this last piece from the patient's ear. And then we're going to go back in and visualize the patient's eardrum. So again, just going to dilate the ear. Get a stunning view of the eardrum. You can see the handle of malleus there, all the blood vessels. Just having a good nosy around. And then you're going to see a still image of all the wax that I removed. So you can see that's a fair big haul. So I hope you enjoyed that video, and it gives you a bit more of an insight of the WAXscope. And if you are interested, please do email info@clearwax.co.uk, and we should add you to our mailing list. Thank you. Bye.